Today I'll show you how to set up the TSS patient and tissue block. First, retrieve the black tray and set it on the table. Now you can place the base tray of the patient on the black tray. This is currently in the locked travel position, which is the lowest level. To adjust it to the level to best view the tissue, move it out of this lowest layer and insert it into the next slot up. And then you can lift it and place it on the level that you prefer. You can use this window to visualize where the tray is located in terms of which level it's at. Now that you've selected your level, you can retrieve the disposable black bag. You can fit this into the base of the tray, making a reservoir so that the fluid can go into the base rather than outside. You can fold it over. And make sure there's a cup at the bottom so that it can catch excess fluids. Now you can retrieve the TSS tissue block. You can cut it open with scissors. Remove it from the bag and just stick the bag into the base of the tray. You now have the TSS tissue block. You can put this into the tray and it'll fit in with a pressure fit, so as long as you push it in, it should click into place. Just make sure that the lung is not caught in between the tray and the base. And then you can move these tubes up to the top where we can connect it to the TSS and the blood bags. Now that the tubes are located at the top portion of the patient, you can take the caps off and set them to the side. And then you can take the caps off of the IV blood bags and just connect these luer locks. Now blood will be able to flow into the tissue. You can take the air outlet from the TSS and plug that into the remaining tube. And now you will have airflow into your tissue. You can take the provided lubricating jelly, squeeze it onto the tissue, and just rub it around so that the tissue stays hydrated and doesn't appear dried out. Now that you have everything connected, you can turn on the blood bags to the highest level. You can stay at this level for about 5 minutes. Make sure you periodically check the tissue for any excess bleeding and monitor the blood bags to make sure it's not dripping too quickly. After 5 minutes and no leaks, you can just decrease the level to about halfway. Now you can retrieve the top of the patient and you can just move it around, feel for the grooves, and just lock it in place so that it can't move. You can remove the 2 layers of tissue and just make sure that the lung is not stuck underneath this tray. And then you can just put the layers back on top, make sure everything fits into place, and just lock it.